بسم الله الرحمن الرحيم. محدثكم بروفيسور عز الدين إبراهيم، استشاري علم الأورام. اليوم ضيوفي 3 ممرضات متخصصين في مجال التمريضي لمرضى الأورام. هؤلاء الممرضات ذو عشرات من السنين الخبرة في هذا المجال. الحين بوجه لهم نفس السؤال لكل ممرضة، وهو ما هو أهم ما تعلمتوه خلال سنوات الخبرة في التعامل مع مرضى الأورام. Thank you very much for joining me. I have a question. The same question will be answered by each one of you. Please introduce yourself and respond to the question. The question is, what is the most important things, or more than one thing, that you have learned through the years of dealing with cancer patients?
This is a very interesting question, Prof. Esaldin. First, my name is Margaret Gorospe. So in my 13 years of experience as an oncology nurse, I have come to greatly value the importance of holistic approach when interacting and dealing with our patients. It is not just recognizing them by their diagnosis, but seeing them as a whole person and as a whole being with diverse needs encompassing their physical, emotional, spiritual, and psychological well-being.
Excellent, excellent. Did you have any previous experience with other discipline other than oncology before? And what is the difference, if you have any?
Yes, in my total of 20 years of experience as a nurse, oncology field is really a different. You need to deal with vulnerable people, fragile, and you need to touch their souls. You know, they are not just like sick people. You need really to look at them in all aspects of their needs.
Thank you very much. Excellent, excellent response. The same question,
yes,
please.
Thank you, Prof. My name is Jennifer Ikshomo. I'm an oncology nurse for 12 years, and I have learned that there are numerous medications that we are able to offer to our patients aside from chemotherapy. We have immunotherapy, and other kinds of medications. And knowing these medications and their side effects, it really helps me in providing proper education to our patients and their families. And at the same time, it helps me to provide a quality care to our patients.
Thank you very much. About the education, do you have any problem of communication? And you have learned some Arabic language word that will help you to facilitate that communication?
Yes, Prof. In this field, it's really important to know, especially we are in Saudi Arabia. I have some Arabic words that I know that they have to know that they should Arabic speak. That Mama lasem intero fil tawarik asyan fi harara kida. That's the only thing I know. I'm so sorry.
Thank you very much. Thank you. That would have a positive effect, I'm quite sure.
Yes, yes.
Thank
Prof.
you.
Thank you.
So, as an oncology nurse for 12 years, I absolutely agree with the idea of Miss Margaret that nursing is not only for anatomy, physiology. I also agree with her idea about the oncology nurse as being competent on the medications we are receiving. Communication is part of it, and to be honest, our patients and their families, they are the one also teaching us how to speak Arabic. On the other side, as an oncology nurse, we feel that it's a privilege for all of us to care for the patients who's facing the one of the life's most challenging battle in life, being diagnosed with cancer. So this experience or this journey has not just give us an opportunity to deepen our clinical knowledge and skills, but it also allowed us to have understanding on what is empathy and resilience. Each patient I has encountered too, they taught me about the importance of the human spirit, the importance of compassionate care, and the significance of fostering hope in the face of adversity.
Thank you very much. Excellent. One final question any one of you can answer. We know that when a newly diagnosed patient with cancer, they go through the psychological process of denial, then they get into the period of anger. Obviously, there will be negotiation, acceptance at the end. But my question is, how would any one of you would deal, if you have the experience, with a patient in the anger phase when they feel that why me? The same kind of question.
Yeah, it's more oftenly happening that for sure it's a process of until acceptance, depression, and anger. Most of the patients who have anger, they have who are newly diagnosed with cancer, the patient is so limited. So if ever my patient or even the family had an anger attack on me, I will not do it as or accept it as a personal attack, but it's their journey. It's a process of them accepting from the new diagnosis. So as a nurse, I have to put my shoe in their shoe, and I have to feel, I have to understand, and I need to understand what they are feeling right now. Because being diagnosed with cancer, it's like a roller coaster of life happening, and nobody among us is expected that, I will be diagnosed with cancer. No, I'm not. Nobody among the people among us are expecting, next day I will be diagnosed. Next day I will enjoy life. So at least if I am putting my feet on their shoe, I will feel, I will experience, although not personally, not physically, the symptoms, but I have to embrace it as well.
Thank you very much. Excellent response. Any additional comment about the same question?
Yeah, I think, Prof, listening is very important at this phase.
I fully agree with
Yeah, because at this time, definitely they will need a support system, or someone who can hear and understand, and we need to give them enough space and enough time to deal and to process the diagnosis of cancer. As what Ms. Janeline just said, it's not an easy thing that you can just in one click, okay, I will accept it. So really listening to them and helping them to process the situation is really a very important thing.
Thank you very much. Thank you very much for accepting joining me in this educational video. I'm really grateful on behalf of all our patients for the outstanding service that you provide. God bless you all. Thank you very much.
Thank you, Prof. Thank you.